consider it banged, right? So just a reminder that this is an official Board of Health meeting and we are live streaming. And so welcome back everybody to official meetings. It feels good to at least get back a little bit to normal from where we've been for the last couple months. So is there, Frank, is there anyone, or Karen, anyone that wanted to address the board this morning that we have?
I don't know, Liz, is there anybody from your enforcement?
No, we had a written submittal that the board should have received, but we do not have anybody to speak.
Okay. So we'll go ahead and move on then. So the next item is approval of the minutes from way back in January, which, Frank, thank you, is, oh, these are our agenda for today. I think the minutes are included in your packet. So can I get a motion from someone?
I'll stop share so you can see hands.
Yeah, if you could, that'd be great. Thanks. How about a raise your, okay, I have a first from Shauna. I need a second from Dr. Evelyn. Any discussion? Okay, so all in favor, or all approving the minutes? Any naysayers, any no's, and any abstentions? Oh, so, okay. So Karen, I think we had unanimous approval. This is slightly challenging to do here. I think we had no abstentions, so I think we're good. Okay, Brenda, financial summary.
The financial summary was included in your packet. So it is the closeout of the 2019 budget. We fared fairly well. I don't have anything additional to add to that one. The April 20 budget report is also included, and we are monitoring our expenses and revenues fairly regular because of the COVID response. So we have revenues not coming in. We have some very high expenses expected in some other lines in order to address the COVID response activities. So I don't really have anything to add.
Any questions from anyone on this?
I have a question. So obviously the Board of Health or the health department has to do what it has to do. Are there contingency plans for external funding if in the end it turns out we had to pay people for overtime or whatever the expenses were?
Yeah, so the big thing is federal stimulus, right? Both for the state and local municipalities. That's the big, unknown at the moment. Without that, there's a huge gap that the county and the state are going to have to try to fill that will be very difficult. But in the interim, the county administrator has directed, the county operations are to continue under the restrictions that he's put in place, from hiring freezes to the furloughs that have occurred. So we've taken steps that he has directed us in order to be prepared. Ultimately, what we have to do in the next couple of months will depend on how this continues to evolve, both from that stimulus perspective as well as sales tax, which is the other big revenue source for the county that is an unknown right now.
The department also received funding from CDC funding through HRI, Health Research Inc. In the tune of, I want to say it was $159,000. That will offset our overtime expense and some of our supply type things that we've had to purchase.
And know that the financial things are still up in the air, right? You may have heard that the county has agreed to buy a Rionics piece of equipment. And so whether that comes out of the health department funding or it comes out of another line, we have to do what maximizes our reimbursement down the road, which ultimately will include FEMA to some degree. So there will be conversations about where monies come from for different projects and expenses related to COVID.
Any other thoughts or questions? Okay, Frank, I'm going to move to you then for your administrative report.
Yep, and I've got a PowerPoint that I'm going to share that I want to go through. It's essentially, I got to see if I can figure out how to do this. Let me see, hold on. It's essentially the county administrators. I've pared it down a bit. Hold on, I got to go to share screen. Share my screen. Share. I think this is how I have to do it. And then I go here, and then I go here. Okay, can you guys see a slide that says COVID-19 Tompkins County response?
Yes.
Okay, great. So if you've seen the legislature reports, you've seen most of these slides before. I'm going to move through them fairly quickly, but I think it gives you an overview of a lot of what's happened since the last time we've been together. So I think by now everybody knows essentially what the Emergency Operations Center is doing. We're following the disease. We're doing a lot of public information, preparing for transmission in the community, and dealing with other community impacts related to COVID-19. And of course, county operations have never really stopped. They've just been modified amongst the different departments. And that's us in the EOC. That's where I've been hiding. Food is a big issue that we've had to deal with. I can't see the numbers because this is in the way. So the biggest deliverer of food has been the school districts. So you can see how many meals that they're producing. FoodNet did a lot of work on getting frozen meals to seniors, and then still doing their regular visits. And then the food bank and pantry. These numbers were back in April, so they're a little outdated, but they've continued to provide additional resources in our community. They've been really good partners. There was an example of a different kind of food bank situation. TC3 hosted them for one on April 24th, and they just did one a couple of days ago again. And it's well over 400 families being provided food. So lots of work around food happening in the community. Childcare, there are spots that have been held for essential workers throughout all of this, and now some of the other childcare, the ones that had closed, are putting plans together for reopening as more folks go back to work through the phases. So childcare was something we focused on a lot early. Homelessness, there was a lot of questions about what we were doing around homelessness. The shelter, they had actually moved their regular guests into hotel rooms to leave space, more space in the shelter itself for the walk-in type folks to be prepared. As far as the out in the jungle or the encampments, Reach Medical actually was doing telehealth services out there. They had an outreach worker that took a tablet out there to support the clients. They were given masks. They've had to move from the dewatering site that the city is moving forward with, but there were only a handful of folks, and that move went fairly successfully. And there's a lot of community partners working with the homeless folks throughout this. And thankfully, so far so good as far as disease within that population. You can, this is the format that Jason has been providing to the legislature for, I'm sorry, I got to shrink this again somehow. For each month, every 2 weeks when he provides his presentation. So first you can see during the week of April 22nd and May 5th, we were at 130 cases, a couple of executive orders, announcements were made, criteria was expanded to include essential workers during that time frame, and the phased reopening plan was launched, and the schools were closed through the rest of the year. County operations, our mask making efforts were in full operation. I think last time we talked, we have since closed those down, but we've made significant. We made just over 900 masks total, and then we're over 2,000 masks that have been donated now. The county's offering leave time for people to get tested as essential workers. We talked with community leaders about reopening. reconstitution of operation plans, or what we're affectionately calling ROOPs now, was something the county developed for our operations, but we've also shared that out with the community as a template. We did also start the process of furloughs. So there were a few furloughs at the health department. Those folks were all notified, and are currently furloughed. And we've been meeting with higher ed on a regular basis. They are part of the larger community conversation on Monday mornings. I'm sorry, on Tuesday mornings, and then on Monday morning, just higher ed meets to talk about their planning and to try to be as coordinated as possible. Communication and messaging has been vital through all of this. And some of the examples, I was on a Chamber of Commerce panel. We did an all staff Q&A with Jason. He's done a couple of those now. I did a PSA that was run on the radio about staying home. And I was on a panel with WRFI as well. We did present some demographic data, which is probably the most interesting of the slides here in this deck for today. We had not been giving demographic data because we were trying to protect the privacy of individuals, as well as we also didn't want any sector of the population or geographical part of the county to think that somehow they were immune to this or didn't need to take the necessary precautions. But when we got to over 100 cases, we felt like it was a time where we could do some demographic information. And so we shared that out with the legislature 3 weeks ago now. We will update this once we have enough additional cases where we feel like privacy can be protected. At the time that we did this, we had 133 and we're at 151 now. So we're not yet to a large enough additional case number to feel confident in that. But what you see in the slides here are a comparison between the positive cases, so amongst those 133 positive cases, and the general population, the total population comparison from census data. So as you can see here, this is the age spectrum. Probably the one that jumps out the most is the 20 to 29 age frame there, where a good portion, 42 of the 133 fell into that age range. But across the board, these are pretty close to the general total population, remembering that there's 133 of them total. You guys can see those popping up, can't you? Give me 1 second. It's Jason and Amy going crazy. They learned how to chat in Microsoft Teams, and it's been impossible to get them to stop. Okay, my apologies. So back to the ages. So it's general across the board, in line with the population. And I'd also point out there's been a lot of question about students, right? And when you see the age 20 to 29, I think people's minds generally jump straight to students, but that's not a good assumption to make. There's been, even in that age group, it's across the board with folks, whether they're related to the higher education or just in our community in general. So, again, with 133 cases, we don't want to draw too many conclusions, other than it does look like we have a general kind of distribution related to our population. The race distribution, again, very similar to our county populations. As you can see, nothing, I can't even get that to stop. You can see the general the general distribution is still fairly similar to the population. There's a lot of folks that when asked the question, it's self-reported. So, they feel like they fall in multiple groups or have a different descriptor for themselves. So you can see that group is fairly high. Hold on, now it's somehow, okay. Ethnicity, again, fairly similar for the Hispanic, non-Hispanic, and unknown. Unknown just being it was not self-reported to us when they were questions, but these are fairly close as well to the population. Source of exposure. So this is a question folks ask quite often. Again, in these 133 cases, 58% of them were exposed to a known positive, so a close contact, and 41% were from community spread. So, you know, that's kind of what we're seeing, and we've continued to see that through the additional cases that have presented themselves since. I think that's the extent. Oh no. And then the geography. So we did put the map out there. As you can see, almost all but one municipality was impacted, and that's the village of Dryden, and that's because I live there. But no, they were just the lucky ones. But as you can see, obviously, where we're more densely populated, there's more cases. But like I said, all but that one municipality was impacted, and so it does point to we're all susceptible, and we all need to be taking the precautions. So those are the numbers, demographic numbers that we presented. Shifting now a little bit to reopening. You've probably seen this by now if you watch the governor or go on his webpage. This is today's metrics of where we stand. We're obviously still in the green. We have been from the beginning, and more of the regions are getting there, including the Mid-Hudson region, which is expected to open this week in phase 1. So we're doing well on these, and we continue to move forward, hoping that on Friday we will be talking about moving into phase 2. So just a little bit about that process. Again, this might be, you know, stuff that you know, but we've had weekly conversations now with community and higher ed leaders, as I've talked about. We're talking with the county legislature on a regular basis, and there are regional control rooms. So actually, when this slide was made, we didn't know who was going to be appointed to those, but we do now. It's Jason Molino, the county administrator, and Mayor Myrick from the city of Ithaca. And those calls happen every day, And so I sit in on those with Jason, Amy Hendricks, and Dominic Recchio, our communications manager. And so it's a lot of question asking by the different counties about, you know, their particulars. Horse racing, you know, was a particular interest for Tioga. There was the drive-through farms for folks to go see the animals and things that were particular issues for Broome and other counties. So very particular questions coming up, and it gives us an opportunity to ask those questions and get them answered. We have set up a spreadsheet that allows for questions that come in that we might not have answers for our folks in environmental health, to get those over for Jason to ask, or get sent to the control room to get some answers. Obviously, some of the measures, things that they were looking at, the measures have become very clear, and they were in that slide, the previous slide, but all of these things were in consideration when reopening was under consideration. Obviously, the phases are there as we knew them back then. They are, if you have not been to the New York Forward website, that is where all of the information is cataloged, and quite frankly, it is pretty comprehensive. And as the phases reopen, they continue to put more and more information on that website. So if you haven't been there, that's a good one to take a look at. So moving on, in the month of May, we moved up to 141 cases. Executive orders continued the previous orders and closures. That was when the dashboard was published, was on May 10th. And that allowed the reopening. The legislature, again, did the furloughs. Our ROOPs were submitted, and many have been now read and approved. I got a stack that I have to get through today. the regional control rooms. We talked with the libraries, again, a lot of different groups and organizations looking for feedback on how to open. And then on the 15th phase one, we began to reopen. I did host a call with local landlords to try to answer some of their questions too. They seem to be okay and looking for additional guidance as the phases evolve around being able to do live showings and those kinds of things. Messaging continued. The moving forward webpage, the county now has its own reopening webpage. So you can find that off of the health department page, or you can search Tompkins moving forward and see that. Continue to do town halls. We're doing weekly town halls that we're hosting now. We participated in a handful of WRFI town halls as well. We did have a community notice about Green Star. You probably saw that. And we continue to put messaging out for staying vigilant as we progressed. I thought this might be of interest to you, just so you could see kind of the number of hours that are being used by staff and kind of what the costs are. This is across the county, not just the health department, but you can kind of see the extent of that and what we're spending for COVID, and then also emergency leave. Obviously, that was a requirement in the executive order, and the county has been facilitating that for our employees that needed. I talked a bit about reconstitution of operation plannings. They were kind of broken out into this framework that you see here. First, the vision of what the department will look like. And they created it in a two-phased approach. One is partially reopening, and then two would be fully functioning in the new normal. And then those different areas, staffing considerations, employee engagement, facility considerations, office operations, and field operations were all components of those groups that leadership had to consider and document as part of the approval process for moving forward. Oh, I thought I took this out. This is the food bank numbers back to May. You can see the amount of food that is distributed in pounds is pretty phenomenal. They've been able to do, and the percentage changes from last year at this time to this year. So there's definitely a demand, and they've been working to meet it. We've distributed a lot of supplies here through the EOC, many of them coming in from the state. But as you can see, we received large numbers of cloth masks, surgical masks, gloves. Surgical masks and gloves have been primarily going to the hospital, as well as the other N95 face shields type PPE. And then the cloth masks and hand sanitizers have been going out to a lot of different organizations. They can order them directly from us, or we've been using both municipalities and the school districts to distribute some of that out for us. Our messaging, you may have seen these symbols popping up in social media: density, distance, face covering, personal hygiene. We've been working hard to get those messages out there and trying to be consistent so that they're simple but powerful in their message. You can see at the time the numbers that we were getting views on our webpage, Facebook, and Twitter. Twitter's really been a big, huge growth place for us in the last couple of months throughout all of this. Enforcement, I'm sorry, these are not the order that I wanted them to be in. They're a little disjointed, I apologize. But enforcement has been handled. Our environmental health folks, Liz and her team, have been taking a lot of the complaint calls. There's a form that you can use on the New York State PAWS website. 211 has been fielding and directing calls, and of course dispatch. So mainly environmental health is essentially handling the complaints related to reopening, business operations, those kind of things. Gatherings, we've been targeting towards dispatch and law enforcement if they're capacity is available to do those things. What I will tell you is our approach has been, we'll do as much as we can, but it is nearly impossible for us to cover everything that comes in. And so really our message to the public has been, please just, take some personal responsibility, be respectful if you're going to have a conversation with someone about, and when you think they're not complying, and also understand that just because someone's not wearing a mask, it doesn't necessarily mean that they're flaunting the rules or the guidance. They may have a medical reason. They may be in a situation that if you look closer might not require a mask. So we're just asking people to be respectful and really take personal responsibility. And then, of course, investigating where necessary. And you can see some of the numbers that have come in to date when we last gave this, which was a week or so ago. So there's been quite a bit of activity. Phase reopening, I think I've touched on this. The control room, daily calls, they're reopening by industry group. And then we are trying to share updates on those with we have a weekly call with elected officials and nonprofits. There's a lot of weekly calls. And just trying to make sure everyone kind of knows what's going on and how it affects us here in Tompkins County, but mainly referring people to New York Forward for reopening questions. And finally, I can stop talking and turn this back over to Christina.
Thanks, Frank. So do we have any questions? And there's two ways you can ask questions. You can literally raise your hand, or if you want to hover below the bottom and click on participants, there's a raise hand function there. So any questions for Frank? Melissa.
Hi, Frank. Sounds like you guys have been super busy. I have two questions. One is, are there any plans for random testing in the community, specifically in kids?
Right now, no. The criteria for testing are folks that are sick, close contacts, a health department exposure, announced exposure, preoperatory needs, essential workers, phase 1 workers. So that's where we are. I'm hopeful that we're going to be moving towards more generally available testing, and nursing homes. I forgot about nursing homes. So the nursing homes and the hospital staff ate up a lot of the local testing capacity. And so we're right at that capacity right now. And so we're trying to be mindful about not overwhelming. There are plans in place, as I mentioned, the Rheonics machine purchases, as well as other efforts that CMC is taking to try to expand capacity. And so as that happens, we'll likely be talking about further availability, but we're not there yet. And we're not, what we're focusing on is new potential exposures. So I would imagine sometime this week we'll be opening to phase 2 workers as well as the next step.
And have you heard of any funding that would be available for us, do you think, for doing testing like that?
So there's CARES money associated with testing, which is why we have to be somewhat mindful about following the criteria, because we wouldn't want, CMC is taking the burden on this right now, right? All of the cost is theirs, and we want to make sure that it's going to be reimbursable for them. And so part of that is navigating through the criteria and following those directives. So I'm hopeful that there will be funding, across the board. The governor and the president have said testing will be free to anyone who wants it, but there's always caveats to that, right? And most of that is staying within the criteria at this point.
Frank, there's a question from Ed, and he's wondering whether all child care facilities are having their employees and children tested.
No, it is not mandated. They are, childcare are essential workers, so they've been able to be tested for a few weeks now. So they can if they choose to, but there is no mandate. Currently, the only mandate is for nursing home employees for twice-a-week testing.
Okay, any other questions? Okay, Sam, you're up for our health promotion program update.
Okay, so in my report, it just notes that all my time has been COVID related. So most of our health promotion programming has been on hold. My staff is working remotely. Some are on emergency leave, but we are hoping to get Healthy Neighborhoods program up and running through some virtual home visits and no contact delivery of home safety products. So with the phase one of our ROOP, we do hope to get that up and going, but otherwise just working on the COVID communications.
Great, thank you. Any questions for Sam? Okay, next we'll have a report from Dr. Klaypak from the medical director's report.
Thank you and good afternoon. Frank is always very fond of mentioning about testing, that we still are a very unique region in the amount of testing we have, and that's part of the dynamic. And I think that's why we aren't maybe seeing guidance from the state with regard to testing in childcare spheres or young populations and so on, because there's just a lot of regions who they're hard pressed just to get the basics done. And then to your question, Melissa, there's sort of two types of general testing. There's opening it up for anybody that wants to be tested for whatever reason to be tested, right? But if you're really going to do surveillance testing, if you're really interested in a young population, you really need to work with an epidemiologist so that when you come out on the other side of getting some data about that testing and the media starts to ask you questions, it means something, or hopefully means something. So that's probably going to be down the road, I would think, as Frank has intuited. We're into the physician surveillance program. We started that with primary care physicians, and almost without exception, all the primary care practices are participating. There are a few that are not. And it's too soon to really look at that data and make anything of it, but if they're reporting any COVID-like cases that they come in contact with each day, and also the number of practitioners that are reporting for that day, because as you might imagine, that number goes up and down on any given day. So any questions for me? My report was pretty extensive, and you might have a question that comes out of that.
Okay, any questions from the board?
I have a question about whether they're doing antibody testing in a way that would give us any numbers for the county alone.
Frank probably has had some conversation with the state, but my knowledge is that it's region by region numbers and not broken by county. So initially when they came into our region, they weren't even in Tompkins County, I think the first go around. I think, Frank, is it true that they've been twice now back, and both times been at a site within the county? And the prevalence number for antibody positivity still hovers right around 2.4%.
Yeah, I'm not sure if there was one or two stops here in Tompkins County, but they have been here, and Dr. Kay's right. It's under 3%. And as far as general antibodies, there is some of that testing happening because it is available to physicians, but we still don't know what it means. So we haven't been focusing resources or energy or encouraging people necessarily to get antibody testing, partially because there's a lot of different antibody tests out there and we're not sure the reliability of all of them. So the ones that are happening through CMC are reliable, and certainly it's good that people are making use of them. But until we know exactly what it means, we're still putting all of our resources towards the PCR positive negative testing.
I would say on the antibody as well as the COVID testing that because of our low prevalence rate, that we're wrestling with the positive predictive value of these tests, because when the prevalence rate is down, then the positive predictive value also goes down. And so we struggle with that dynamic all the time. Ed was wanting to ask a question.
Yeah. Are these positive antibody tests being reported to the health department?
Yes.
We encourage that, don't we? We were talking the other day about as the venues for this antibody testing to expand into more and more commercial sites, and even the pharmacies have been permitted to do COVID and antibody testing. Technically, they're supposed to report to the health department. Practically speaking, do they? And we try to encourage them all, of course, to coordinate with us.
It's happening generally through the labs, through eClairs is how we get the results. So it's not like they're necessarily calling the local health department, but there is a reporting mechanism for those results. But we don't use the antibody results as in order to make decisions on what we do with the individuals.
So there's a question in the chat about WellNow and the tests that they're using for antibodies. Do you know anything about their tests or have any commentary on that?
Yeah, I talked to the general manager there. They are doing PCR testing only for sick individuals. So you have to have symptoms for them to do the positive negative. They will do the antibody testing. They send it to a laboratory in Boston. So I think best case, it's 7 to 10 days before they're getting those results back. They haven't done huge numbers of them to date, but it is available. We don't know, and they couldn't really tell me what their capacity was. So, and because they're only doing symptomatic individuals, we haven't really put out information about them. They've done their own advertising, but they don't have the capacity that we would want to advertise them as an option as we do with CHS.
One of the dynamics is the turnaround time for these tests, and a number of the venues outside of the CMC system and so on have a longer turnaround time of upwards of a week or so. But even it's important, I think, for you all to know too that the turnaround time through the Cuba Health System, the medical center's lab turnaround time, depends upon what methodology and system was used to test it. So there's a certain capacity for results to be, for the specimen to be collected, tested the same day, and then that result to be turned out promptly. But if a certain capacity is exceeded, then you start to get into a 2-day or perhaps 3-day turnaround time. And then in the worst case scenario, we get a mass situation of some kind, then it goes even potentially to a less certain turnaround time. So even for people within the general major system, turnaround times can change. And so that's why you'll hear people say, well, I thought this was a kind of a same day result or something. Sometimes it is, and sometimes it isn't. It just depends. So we try to help people through that process at the health department when they call us and say, well, where's my result? You know, I expected that already.
Okay, any other questions from the group?
Dr. Dundali, your question in the chat box, I don't know about the reliability of specificity for the WellNow because they're using a lab out of Boston, and I just don't have access to that information.
Yeah, thank you. Because I trust CMC, but I don't know much about WellNow, so.
It seems like it varies from lab to lab, and Mayo Clinic's is very good with, I think, somewhere around 90 to 95% sensitivity, and probably closer to 99% sensitivity. The one that we sent to is LabCorp, and they're pretty similar. They use an Abbott test. So, but it does vary quite a bit.
What is your turnaround time now with LabCorp, Ed?
So for the antibody test, that could be up to a week. For the PCR, it's typically 2 to 5 days.
Shauna, I saw your hand up.
Yeah, so my wife and I actually did the antibody test at Well Now, and we did have our results back in about 4 days. And they said that it was anywhere from 94 to 97% accurate.
There are different types of accuracy. So you could say 94, 95% specific and sensitive, for example. But if your prevalence rate within the area is low, then you have to talk about something called the positive predictive value.
Right.
And sometimes that'll drop it to like 80%. So that's what we struggle with, this positive predictive value in a region of low prevalency. Thank goodness.
Mhm.
Yeah.
Okay, any other questions? All righty. So Sue's asking a question about whether the colleges plan on doing their own testing in the fall or whether CMC is going to take that on. So I don't know, David, if you can respond to that, or Frank.
I'll let Dr. Evelyn try first.
Well, I guess what I can say is that we have been in discussions with Cornell, Ithaca College, Wells College, and TC3 about testing. And at this point, no, nothing is kind of set in stone. It looks like it'll be some collaborative kind of effort where we may be sending some people up there to help with initial swabbing. The colleges will want to have some ongoing swabbing capability so that they can test people who develop some kind of symptoms going forward. And we hope that it'll be something that we're collaboratively working on with all of the 4 educational institutions in our community and the hospital together so that we can set some standards and have some collaboration and cooperation on this. That's probably all I can say now.
I could also fill in and just say I've heard the same thing at Cornell, that it would be a collaborative relationship with CMC on testing.
And I've been encouraging the higher ed groups to work with CMC because of the relationship that we have with them. It makes it much easier from a local public health perspective to work with our partners at CMC than it would be if they were to, use another lab. Obviously, I can't tell them they have to, as much as I would like to. They can figure out whatever works for them. But it does sound like that collaboration is in the works, and we're hopeful that, as Dr. Evelyn said, something can be developed that can be consistent across the community.
And then, David, are you having the same conversations with the K-12 school district as well, or just the colleges?
No, we had an initial conversation with the K through 12, as well as conversations with the nursing homes and with some of the other congregate living things like Racker. I think the governor pushed the nursing homes kind of to the forefront. So most of the advanced conversations, and in fact, we already have contracts with many of those institutions for their testing. At this point, we're kind of waiting to see what we can develop with the colleges, and then at some point that'll have to go through the K through 12.
Great.
Melissa's going to become our champion swabber.
Yeah.
Yeah. It is important to point out the prioritization of resources too, right? So we don't have an infinite amount of testing available yet, although CMC is trying hard to make it so. And for K through 12, those are folks that are in our community and are here right now. And we know we have low prevalence of the disease. So for the higher ed, that's bringing in a lot of people from a lot of different places that might have varying levels of COVID-19 in their communities. So they're a higher priority as we begin to talk about bringing those large numbers of people back into the community.
Okay, any other questions or comments? All right, I'm going to move on to Karen and the report for the Division for Community Health.
Good afternoon, all. Undoubtedly, our primary activity since the beginning has been our COVID-19 response to reported positive cases, including all the case investigations and contact tracing, daily video chats with our positive cases, daily phone calls, monitoring persons who are in mandatory quarantine, and calling, and eventually daily texting persons who are on precautionary quarantine. This has been a monumental task and continues to be a 7-day-a-week operation. Monday through Friday, it's a nice mix of community health services, nurses, as well as Debbie's children with special care needs nurses. And then on the weekends, we've morphed into 4 to 5 staff for Saturdays and Sundays and holidays to tackle whatever presents on those off hours. So I'm pleased to say that all of our staff have gone through the Johns Hopkins contact tracing training module, and as a department, I think we have about 36 total individuals throughout the entire department who've gone through that training. For feedback from my staff, who this is what they do every day, the training was still valuable, and particularly the effective communication module that really teased out good interviewing skills and techniques to use. So very worthwhile. Last week, we were a part of the second wave of local county health departments to go live in this new COVID specific software called ComCare. We went live with that on Thursday. We've had a few hiccups, as you would imagine with any new software. And so this week we'll continue to kind of iron out those challenges, and hopefully it will make it a little bit easier. It's specific to contact tracing for COVID, and so we should be able to glean effective reports that we should be able to share some data eventually. We're not there yet. So from a numbers perspective, as of yesterday, we have 153 positive cases. 128 of those have fully recovered. So that's the great news. We are keeping current with all other reportable communicable diseases that come our way, and continue to provide services to several tuberculosis cases that we're doing video chats with for direct observed therapy. We're also using the video chat or telehealth to keep in contact with our MOMS clients, and to some degree, some of our Safe Care clients. So all other program service areas continue to be suspended. So I think that's it for me.
Okay, great. Thanks, Karen. We've got a couple of questions for you. I'm going to lead with mine, and then I'm going to talk about the ones that are in the chat. Do you have a sense on average of somebody who has tested positive, the number of contacts you're having to trace? So like for an average person, is it 15 contacts, 20 contacts? Like can you give us a sense of what that means?
Sure. So probably minimally 2 contacts, Probably on average, it's more like 6 to 8.
Okay.
Depending on the household size for sure. And of course, we've had a few outliers that it's, you know, been in excess of 20. So go ahead.
Well, yeah, so I wanted to tie it to the previous questions about the colleges and testing, which is that do you have a sense for a college student or a faculty member or staff member that's working in that kind of institution, what number of contacts you are anticipating that you would have to trace? I'm assuming it won't be 2, so.
Right.
Yeah,
So-
we had this conversation with Cornell a few days ago for the very same reasons, trying to understand what it might mean. The challenge is we don't know what your environment is going to look like, right? So their reason for the question was how many apartments do we need to keep aside for isolation quarantine, right? Which I'm assuming is where you're coming from. The challenge is, you know, if it was the way college was in January, you would need a lot of apartments. If they're coming back and you're, you know, reducing the size of classes, you know, requiring masks to be worn, you know, doing strong education, people are responding well, the chances are the contacts might not be as much as they would have been back in January. So it is a little challenging right now to know because we don't know the extent of, you know, what your operations will look like.
Okay, so let me segue then into the question from Melissa, which is, are you encouraging community members to be trained in case you need them?
For contact tracing?
Yeah, Karen or Frank, since Karen was talking about the Johns Hopkins module.
Well, I'll jump in for the community part. Karen's been handling the department. We needed to have 30 and a half contact tracers for our share of the reopening. And so it was easiest for us to identify those folks within the department and get them trained so we could do it. I think the reality is if we get to a point where we need folks, we would likely want them to get trained closer to the time that we need them versus doing it now and then having to redo it again later on down the road. I also believe that if we got to the point where we needed 30 tracers, things would be pretty significant in our community and my EH folks would be busy with other things and so not be available, and we would likely need, we'd probably start with other county employees first, you know, depending on what the impact was in county operations, but we would identify folks, and the training takes 4 to 5 hours, 6 hours tops. So it can be done in a day and we can get people rostered, and it would be better that it be fresh in their mind, particularly coming new to it. So that way we could then work with them if we needed them.
And so would you extend that?
Anyone can take it if they want to. It's available.
Okay, and Ed is asking, would you extend that to the colleges to ask us for assistance as well, either you know, among students, I'm assuming, or staff or employees, or are you only going to focus at the county level?
Yeah, Ed, we talked with Sharon last week about this very issue, and Karen Bishop, and I don't want to put words in her mouth, but I think between the two of us, we want to do the contact investigation piece of it, just simply because people are more open to giving us the full story than they are their employer or their educator or someone else that they have a different relationship with. And we've experienced that over the cases we've had. And so we would want to, whenever possible, make that first contact. But when we get to the point of the daily follow-ups, we think that's a point where the colleges could really step in and help us kind of navigate that. So we've been having conversations with Cornell, and we'll have to have those with Ithaca College as well.
Okay, and then Sue had a question about the success of contact tracing, because there's a belief that folks won't or don't answer their phones. So Karen, can you comment on what the experience has been so far?
Yeah, yes, we've been very successful in reaching folks, and particularly when it involves either Cornell or Ithaca College. There are times that we reach out to our counterparts at both health centers for an alternate way to get a hold of the person, whether it's through secure messaging or what, in whatever way they can assist us. But for the most part, when we get a report of a positive case, we're responding to it same day and have at least reached out to that individual. And then the hard part, as far as contacting all the contacts, happens after that. So I would say overall, we've been very successful.
Great.
The new ComCare system that Karen was referring to does have a connection with the Amazon thingamabobber
Yeah.
that allows you to mask your phone number so that it comes up and says New York State contact tracing. So hopefully if we get to a point where that becomes a problem, we would be able to access that. So that way it wouldn't come up as an unknown number or potentially spam. It would say New York State tracing something.
Yeah, it's through Amazon Connect.
Thank
Yep.
you. Yep.
Yep.
Karen, I think you might have addressed this in your report, but can you talk about routine vaccinations and what is happening with those? I think I saw that you were going to re-engage with that on phase 2, but is that correct? What's the status on that?
So the current status of that is we've put everybody into kind of a suspended or postponed status. So folks who had appointments at our immunization clinics, we've kind of put them on temporary hold. And so we'll bring them back in the next phase, and we'll do it in a very staged way if that is approved. And we'll really look at primarily the safety net for kids for primary immunizations as our priority 1 versus an adult who needs perhaps just a booster. So we're looking at kind of filling that gap in the community for those most vulnerable, which would be the wee ones.
And Dr. K has been providing communication to our local providers about the importance of vaccination and continuing to provide those, particularly for children. So we have been doing some targeted communications.
Have you heard anything from the state about relaxing guidelines in the fall for those state mandates? Okay.
No,
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 we haven't
nothing.
even made a decision about whether they're opening the schools.
Right, that's true.
Okay, any other questions for Karen? And I didn't miss any in the chat, I don't think. Okay, Debbie, children with special healthcare needs.
Hi, everyone. I'll just give you a little quick rundown of what's been happening since March. For 2 weeks, we had all of our programs suspended, and we were all of our staff, 10 of us, nurses, 2 support staff, or 3 support staff, I'm sorry, were totally immersed in COVID work. After 2 weeks, we decided we needed to get our other programs up and running. So we are now totally functioning with all of our programs in children with special care needs. Our referrals are still down a little bit. Doctors' offices are still not up to their full capacity with seeing kids. But we're still doing no face-to-face visits with either our service coordinators or our therapists out in the field. Everything's done on virtual platforms or phone conferencing. And we're going to continue to do the COVID work daily meetings, and we're providing weekend and on-call coverage. Finding that maybe 60 to 70% of our families are participating in teletherapy. A lot of our families are really continuing to be overwhelmed with either working from home, trying to keep up with children's schoolwork at home. It's really been a challenging time. But I think we're being pretty successful with keeping our programs running.
Great, thank you. Any questions for Deb? Okay. Jonathan, County Attorney's report.
Sure, not a lot to report because Frank covers a lot of it in the presentation that he made. One thing that's sort of interesting is So I'm a 40-hour employee, and if I spend, which I probably do 30 of those hours on COVID-related issues, that's not counted in those employee hours that Frank gives, because it's only, for example, if I went above 40 hours and got paid overtime, which I don't anyway, would they be counted? So there's really much more county employee effort goes into the COVID routine than are reflected in those numbers, because those are only numbers used for reimbursement, and they're not going to reimburse my hours, for example. So just a curious thing. Interestingly, so court is now open and people are allowed to do filings, et cetera. Hearings and et cetera are still going to be by Skype. Still have no idea what they're going to do about jury trials, et cetera. But so at least my office should be getting back into more normal things, starting last week, actually, when court opened. But it's still going to be remote. And, you know, it's just part of everybody trying to get back into the normal routine. But that's all I have to report.
Great, thank you so much. Any questions or comments? Okay, Liz, environmental health, or skipped doing. Okay.
Hi, so I don't have much more to report than what was covered in the highlights we prepared. As Frank mentioned, we are becoming involved in the reopening. So we're continuing to get complaints about things under pause, and then we're also getting inquiries about the reopening process. So that's been keeping things pretty busy. We're also starting to look at issuing new permits, as well as permits for things like campgrounds that have been either closed or under limited operation. So a couple of things related to the actions today. Well, one thing, grassroots, we pulled that enforcement action, just so you know, that had originally been on a Board of Health agenda, I think, at some point in February or something like, or maybe the next meeting. But given that they are not operating this year, we have pulled that enforcement action, and we'll work with them separately. Country Inn and Suites, there was a submittal that I hope you all received that was sent out earlier this morning, about their request. And then as we go through the resolutions, I have a number of changes we'd like to propose to some of the resolutions.
Okay, any questions for Liz? Comments? Okay. Frank, I don't think there was a CSB meeting, or has been a CSB meeting, or has there been that there's a report on?
There was, but it was mostly just an update of COVID-19 activities and departmental activities there at the beginning of May. So they were the first, I think, advisory board to meet when they reopened. Okay. But it was really just a report out on the department status.
Can you give an update maybe on the integration activities and what you anticipate as a timeline for re-engaging on that topic?
Yeah, we've delayed everything now until August. We were doing it month by month, but it just seemed better to, instead of continuing to reschedule things, to just delay, because it's likely going to be through the summer, through reopening, before things get back to whatever the new normal is for me and the EOC, potentially, winding down at some point. So we haven't abandoned it by any means. We'll get back to it. But right now, I think we're looking for August to begin to start scheduling the next round of get-togethers.
Okay, Sue's raising a good question, I think, related to that in the chat, which is our ability at this point to connect from the public health side to the mental health service side as we start to reconnect with businesses and employees and families who may be really in need in some mental health support services, whether the staff that are coming in contact with them have the ability to help make those connections to available services.
Yeah, so I'm going to talk. I'm not sure I caught the whole question, but so mental health services are available. What we have heard is that the crisis line, suicide prevention and crisis line, their calls have almost doubled over the last month or so. The hospital has been steadily busy with behavioral health clients, but both our clinic and family and children's, we're not even close. We're about 50% of the intake numbers that we were pre-COVID. So we put some messaging out the end of last week, and we're going to continue to push it, that those services are available and that folks shouldn't wait until they're in a crisis to seek help, that we're here, we're ready to serve. All of our services are available. They may just look a little different than they used to, but there is definitely a need, and there's also a need to connect people with the services.
Great, thank you. Okay, any other questions or comments? All right, I think we're ready to move then into new business. Frank, did I forget anything, or are we good?
No, I think we're good.
Okay, so Liz, I'm going to turn it back over to you. The first thing on the agenda has to do with the approval of the 2021 Environmental Health Division fees. And these are in everybody's board packet as well.
Yeah, it's an interesting time to be trying to predict fees for 2021. There's certainly a lot of uncertainty now. And we expect people will be recovering next year. So we did present all of the information that we normally give you, but we are not proposing, we're proposing holding all the fees at the same level that they currently are at for 2020. So no changes in the fees. So we're showing a slight decrease in revenue, I can guess because of that, with some things predicting less operations. So I don't know if you have questions, but that's the basic approach we took.
And just let me give a budget overview that might inform, some of the decision making on this. This obviously will not be a usual budget year. The county administrator, I believe, is going to maintain the June 1st to July 1st submittal time frame for departments. So we're coming up on, beginning our budget development. We're likely going to be submitting multiple budgets to him with varying degrees of reduced revenues. We haven't gotten the specific guidance on that, but expect it any day. But the budget process is going to be a lot more fluid than it has been in the past, and we'll do our best to get things to you all as timely as we can, as we move through it, understanding that the budgets are going to be challenging this year, and I think Liz's approach of a maintenance of fee makes sense, both from a wanting to protect the people we serve, knowing that they're having tough times, and also the uncertainty of what a county budget is going to look like. At this point, keeping things steady and constant wherever possible is helpful when we have so many variabilities.
So the only other thing I'll say is, to remind people about what the process is, or I can't remember if everybody's been through this, we present the fees ahead of the budget, and this is your chance to comment on them. We don't need a formal approval on the fees, that's done with the formal approval of the health department budget.
Okay, so any comments for Liz on the fees? Okay.
A lot less interesting than the previous discussion. All right.
That's right. Well, I think it makes sense, probably, given where we are right now. So I think it makes sense as a next step. Okay. All right. So without further ado, then we will move into our enforcement actions. So Liz, you had mentioned that as part of your report that you were going to be proposing some changes. Are they the same changes across the board, or they're specific to each one?
I think it would be better to go through them one at a time. So.
Okay, and so will it require, are we amending what you have, or what you're asking us in here before we start?
But they're very basic amendments, and I can just, I mean, I think they'll be easy to follow. It's basically fees or deadlines are the only things that we're changing.
Okay, so let's start with the first one, which is Easy Walk. And if I can get a motion from someone with a raised hand. I have a motion from Melissa to move this as written, sorry, and a second from Ed. Let's open for discussion. Liz, if you can give us a sense of what's going on here.
So this is a resolution that previously came to the board, but they have requested an extension. This is Easy Walk. So they are located in the mall, which is currently closed. So they're currently not in operation. If we go through our phases every 2 weeks, which would be the speediest or the fastest that we would be reopening the different phases, then phase 2 would be May 29th, this Friday. But next phase 3 would be June 12th, and phase 3 is where they're showing restaurants would reopen, and who knows what restrictions and stuff there will be with that. But that would be the earliest that I think that they would be opening operational again. So so that was one factor in in our discussion of their request for an extension. One of the requirements, it's number 4 in the order, is that they have to have 2 staff take ServSafe. And we have proposed extending that deadline to July 15th. That's the same thing. There's no change on that. That's a change from the previous order. And that's what's in the version that you have in your agenda packet. So I'm just pointing that out. The fee, the penalty, number 1, we would like to change that to be due September 15th to give them more time in operation. Their permit expires September 30th. So, you know, if there's any issues, we just wouldn't be reissuing their permit on September 30th. So the only change then to the current resolution before you is to change the penalty deadline from July 15th to September 15th in number 1 for your consideration.
Okay, any questions or comments for Liz? Okay, and Frank, just tell me if I'm not doing this correctly. I think I can do this with a friendly amendment to approve with a change to number 1 from July 15th to September 15th. Is that correct? That's what you're asking for?
As long as mover and seconder are good with it.
Okay.
I'll make that friendly amendment.
Okay. And so all in favor then? Okay, Shauna, are you going to vote or come back and vote, or I just want to make sure. Let's also look over the other thing. Let's do it this way. Can everyone use the raise hand function? Because some folks are blacked out and some are not, so it's hard for me to tell. So all in favor, can you raise your hand right now using the raise hand function? And which one? Do you know how to get there? Go to participants. Go to participants. Can everyone see it?
Oh, I see your participants. Do you see it, Skip? Oops, I muted. Forgot.
I usually use it all the time on other Zoom visits. It's not on this.
Not on this one.
Bar. It usually says reaction, and it's not there. So.
Yeah, you should be able to see it because Melissa just used it. I can use it. Is there?
Bottom. It's on the bottom right-hand corner of the participant window.
Yeah. Which it's not there right now for me when I use it every day.
Okay. So I think we've got everybody except it looks like Ed, so you'll have to vote by like this, okay?
Maybe
Fashion
because
way.
it might be you today. That's why. That's.
Oh, okay. You gotta be the old fashioned way. So all in favor is up there. Okay, so lower your hands now, please. And then Shauna, did you want to get a vote in? Okay. Anyone opposed? And any abstentions? Okay. All right, number 2 is
Sean, Christina, it might just be easier to let Liz give her recommendation first and then just have the motion, the original motion be with the amendments.
okay. Go ahead, Liz, for Jim's mobile home park.
That's easy for Jim's mobile home park because we have no changes over the current resolution because it's a mobile home park and they're in operation, and I have to pull this up, but I think it was their water system.
Stymied, Frank.
Yep, just like that.
Okay, so we need a motion on the table regarding how it's as written. Okay, David is our first. Do we have a second? And we've got, it looks like Sue is our second. Okay, discussion.
So this was, it's a mobile home park, but they're a regulated water system, and they failed to submit sample results back in 2019. And so this is requiring that they pay a penalty and then collect any samples that weren't previously submitted.
Any questions or comments? All right, let's use the raise hand function. Everyone in favor, raise your hand. Okay, go ahead and lower your hands. Anyone opposed? Raise your hand. Anyone opposed? And any abstentions? Okay. Moving on to our third enforcement action, Brew 22 Coffee and Espresso. Go ahead, Liz.
So this is another one that we do not have any proposed changes on. It's a food service operation, but it is currently operating on a takeout basis, and the issues were with their water system.
Okay, great. So I need a motion to move forward as written. Someone raise their hand? Okay, I have a first from Melissa and a second from David. Discussion? Anything to add, Liz?
No.
Any questions or comments from anybody else? Okay, all in favor as written, please raise your hand. And Ed is a yes too. And we're going to go ahead and lower hands. All opposed? And any abstentions? Okay. Moving on to the John Joseph Inn. Liz?
So John Joseph Inn, this is their, it is a temporary residence, and they do weddings, which they currently cannot do. And the violations are with their water system, that they did not submit sample results. However, because we do not know when the weddings will be functional again and how those will look, phase 4 would be June 26th, which would be, I think, the earliest that they would be able to do anything. So we are proposing to extend their penalty of $500 to have that due September 15th. That's the only change to the resolution that you see.
Okay, and there's no changes needed to 2 through 4?
Correct.
In terms of dates? Okay. Okay, so the motion, if we can get a motion from somebody, which would basically be as written with the exception of the change to number 1 to move from July 15th to September 15th.
I'll move it as written.
Okay.
Excuse me, with that change.
Okay. So I've got move from Jan, a second from somebody, a second from Melissa. Discussion? Questions,
Well,
David?
I just would like to point out, I mean, I'm not changing this, but I would just like to point out that the violation is that they didn't submit these samples in 2019 for the second, third, and fourth quarter. So they were out of compliance beginning in April of 2019.
And are they now in compliance?
Yes. We did receive the first quarter samples. You could have seen Skip's mouth moving on that probably.
And have we seen them before for water issues?
This isn't, they have been, yes, but that was a while ago. It was long enough ago that we're not counting it, right, as a violation of Board of Health orders.
Okay, any other questions or comments? Okay, all in favor as written with the change from July 15th to September 15th, raise your hand. And we have also a yes from Ed. Okay, go ahead and lower hands electronically. And then if you are opposed, you can raise your hand. And then also now abstentions. Okay, great. Okay, next enforcement action is the Country Inn and Suites, and Liz has reminded us too that they we received by email, and I think it's also in the packet now electronically, a letter or an email that was sent to Skip from Country Inn and Suites. So with that, Liz, go ahead.
Yes, so the Country Inn and Suites is a hotel. This enforcement action is about their pool. They had quite a bit of difficulty operating their pool and within acceptable parameters. So there are a number of requirements in the order. They have requested that the fee be waived or reduced, and they did submit an invoice that showed that they had a new flow meter and maintenance done. They are hiring a maintenance company according to the email that they submitted, and they're also hiring somebody to manage their pool. They are taking actions. Their pool is not open right now, and we don't know when those will be reopened. Sounds like because the company has restrictions in addition to the New York State restrictions. So we are actually proposing to waive the penalty for them given the current situation. Yes, so I think, so that would be essentially eliminating number one and then keeping the remaining orders 2 through 6, which would now then be renumbered 1 to 5.
Okay, so the motion then would be as written, however, with changes with number 1 being completely eliminated. So there would only be 2 through 6, right? There's not
Correct.
a 7 yet. 2 through 6 remaining. Is there somebody who wants to give me a motion for that? I have a first from Ed and a second from Melissa. Okay, so let's open for discussion. So why would we eliminate the fee for them and not for anybody else?
They're taking all of the actions that we've wanted them to do, and they have not been able to operate at all with their pool. So that also has an impact on their TR business. So we just felt like, given that they are making changes that should correct the situation, since they haven't been in operation, they'll have to have a new inspection, and we'll have to make sure that things are okay before they reopen. And so we felt, so we were comfortable waiving their penalty in this case.
Any other comments or discussion? Okay, so we'll vote with the change as written, except the change to number 1, which is is removing the penalty. All in favor? Raise your hand. And Ed is in favor. All opposed? Raise your hand. Let's give everybody a second to all opposed. Okay, and anybody that wants to abstain? Okay. All right, I think that's all of our enforcement actions. Frank, you have administration back on here for COVID-19 update, but is there more that you wanted to, that you haven't, is there possible there's more you haven't already talked about related to COVID-19?
Yes, I have another PowerPoint that I wanted to share. No, I'm good. Thank you all.
Actually,
okay, sure.
So
Well,
Frank, it's been my impression that with the various phases of reopening, that there was a 2-week period of enacting that phase, and then yet another 2-week period of evaluation before you went on to the successive phase if you were going to. Has that been changed, or did I misunderstand it?
Yeah, I don't think there was ever clarity about that. And I think the working assumption is that the phases would last 2 weeks. That it's not a 4-week where it's, 2 weeks of phase and then 2 weeks to evaluate. It's 2 weeks. As long as your metrics don't start to move, then you would continue forward. It looks like on Friday we would be eligible for phase 2 is our current understanding.
With the incubation period of the COVID, that's about as short as anybody could ever push it, and probably too short to really see that phase 1 impact, I think. I don't know if other people have it.
I think you're right, Dr. Claypack, and I also think they're trying to balance against getting things back operational. Because to your point, the number of actual cases isn't one of the metrics. It's hospital usage essentially are the big ones that it could change. And you're right, if the disease progresses from positive to getting sick to getting hospitalized sick to getting on a ventilator, that's probably not happening that quickly. But I think if we saw a significant uptick in cases, we would think about what we were doing, and all of that would play into it. But no, right now, I believe every 2 weeks, as long as the metrics haven't moved, the phases will continue.
So the two indicators we have for cases are the number of positives that we have through COVID testing, and then whatever we glean from primary care surveillance. I don't know of any other ones we can use.
No, I agree. I think that's where we are. And right now our numbers are so low that I don't know that even another 2 weeks would make a difference unless we saw a dramatic spike that, I don't think any of us are expecting we're going to see. So we'll continue to watch it. And if anything gives us pause, we'll certainly consider it and talk to the region.
Alyssa?
I just wonder if there's any update on Mike's position. I know it's sort of probably taken back burner, but I didn't know if we were starting to think about it again.
Yeah, I think we were close back before all this started. I got to go back to my notes. I think the mayor had okayed someone that we were supposed to be bringing to you, which we probably should have brought today. But I'll circle back with Brenda and we'll get it on next month's agenda for your review.
It might be somewhat difficult, Frank, because I think it was a restaurant. We were trying to get a food service person, and that could be more uncertain right now.
Yeah, so we'll have to follow up obviously before we do anything, but we'll get it back on the agenda and move forward. It was difficult, and we were essentially down to one person, and I think the mayor signed off on that. We just never got it to you all, but we would want to circle back with that person now, obviously make sure they're still interested, and then go from there.
Could I ask Liz, can you give an estimate like through this past weekend of coverage, after hours coverage that EH did, how many phone calls are you getting? What's the burden there?
What type of phone call? We get it depends on what type of phone calls you mean, right? It's rabies season. In terms of COVID complaints, we don't get that many through the after hours calls. Maybe a handful is what I was thinking. You know, and then some calls we were trying to encourage like gathering calls to go directly to dispatch, and other complaints come through the New York State pause complaint line. So, you know, so it's, I don't know that our after hours calls are a good indication of the inquiries that we're getting necessarily about complaints or reopening.
So is it safe to say that in terms of actually having to pick up the phone over a weekend, that so far, knock on wood, things are manageable? Well,
a lot of the inquiries that we're getting would not be something that we respond to as an emergency situation. If it was a gathering, we could forward that to dispatch, but most of the other ones we would be waiting until Monday, or Tuesday in this case, to handle during normal business hours.
Great. Any last comments or questions? All right, a motion to adjourn from someone. Show a hand. A motion from David, a second from Ed. All right, we're adjourned. Have a good month, everybody. See you next month.
Good to see you all.